play. Hello, hello, everybody. Welcome to Chats. You guys could please put your first, last name, and email address into the chat box so that way we can send you all the fun stuff afterwards. And then my question of the day while we're waiting for people to come in is, why did you want to work in the ECE field? I think sometimes we forget why we do it, and it's nice to remember why we do it. The reason why I do it is because I have a passion for children. That's all I know too, and I just want the field to get the recognition it needs and deserves, and for the teachers and staff to matter to everybody else. Whole order. Anybody else? Why'd you do this profession?
I think when I started this almost 30 years ago, it was because of my daughter being so colicky. Well, now that she's 31 and, she's been independent for a long time, I think I do it also to give a place where the children feel safe and loved. And it's just become my passion also.
Thanks, Rosemary. I appreciate you speaking out. It's awesome.
I originally started in the ECE world because I was 14 and a half and I got my worker's permit. And at the time, tutor time was one of the only places that would hire 14-year-olds to work there. And just quickly fell in love with the little people and just watching them grow and making sure that they have a safe environment and making sure that they're getting the proper education and start that they need to continue on their educating journey.
Also on mute. Love it. That's awesome. You started at 14. That's insane.
So I started when I was 15 in high school. You can't hear me, huh?
We can hear you, Angie. You're good.
Okay. Sorry, it wasn't working when I was in a meeting yesterday. I started when I was in high school, like after school, just to volunteer. And then I became a teen mom. And so I've been doing it ever since. I've never stopped. I've been doing it for 30 years. And I wouldn't change it for the world.
Get it, girl. Yeah, you have been doing this for a while and you do a great job. Anybody else wants to share? If not, I'll hand it over. It sounds like it got quiet with people coming in. I'll give like 2 more minutes if anybody wanted to.
You know what? Can I mention something? Yesterday, I was over at that huge center that shut down off of 128th in Colorado. They had a room where they're giving away manipulatives, books and CDs and stuff. But they were talking about throwing a lot of stuff out, but the one lady said, no, let's try to give it away free. And today's the last day for it, but they're going to be adding to it. And they're supposed to open in January, I think the middle of January. One of the ladies there that's in charge used to be with Adams County Association of Family Child Care way back when. But I also mentioned to her, if there's things to get thrown away, near the time that they need to get rid of, I told them to get a hold of ECPAC. Because when you do functions, you may be able to use them to give away to people. I hope that's okay.
Yeah, totally. We'll figure out what to do with it if they do call, and maybe there's some other sites that don't know about it that we can send it to as well, the information. And that's great for anybody here. Maybe they didn't know about it either, because I honestly didn't know that they were getting rid of their stuff. So good to know. Appreciate that.
Yeah, they're turning it into a Montessori school.
Ooh, that's a
And
big
that's
building.
a huge
Yeah.
property there. And I kind of hope that they succeed, but yet they're taking away from the children that we may get, because that's a huge center.
Yeah. Well, maybe they won't open it to as many as they're licensed for.
But it's
a lot.
Huge center.
Oh, yeah.
That's the one with the bowling alley, the cooking thing for kids, the basketball place.
Yeah. Yeah. It was a big center. Thank you for all that. I appreciate it. Well, I'll go ahead and hand it over to Candace, who is with Adams County Health Department. I got to remember not to say Tri-County anymore. So Candace, take it away.
Hi all, I'm Candace Bray. Thank you, Amanda, for that introduction. I'm our new supervisor with Adams County Health Department for our school and child care inspection program. And then I'm just here today to kind of talk about what we do at the health department and a little bit about what we look at on our health inspections, just kind of give you a brief overview. Let me know if you have any questions. Feel free to reach out anytime. I think I know a good majority of you or have met you before, so hello again. And let me see if I can share my screen here. I'm not super techy, so hopefully all can see my presentation. Okay. Am I up and running? I look good? All right. Sounds good. So once again, I'm Candace Bray with Adams County Health Department, previously part of Tri-County Health Department. The band broke up, if you guys haven't heard, and we have all separated. So Tri-County used to cover Adams, Arapahoe, and Douglas. We all broke up and started our new health departments. So now I just cover with 2 other staff members our child care and school facilities within Adams County. So if you guys have any questions, please feel free to reach out. Happy to help. And then let me see if I can, perfect. So kind of what the role of the health department is to prevent, promote, and protect is kind of our 3 pillars. So what we really look at is keeping food and physical environment safe, preventing the occurrence and spreading of diseases, preparing and responding to emergencies and disasters, kind of like COVID-19, promoting education and services to reduce community illness, increasing access to healthcare services, and protecting our health within the community. So upholding and improving community health policies and continuing to access and improve community health needs. We do this through a wide variety of different services. So from, I won't read this whole list off to you, but we do have programs within sexual health, food access policy programs to try and get more access to healthier foods. We do issue birth and death certificates. We have immunization clinics. As well as our WIC programs and nutrition, nursing family partnerships and support partnerships, and then communicable disease, helping with communicable disease within our communities and managing that, as well as my section of the health department, which is our health inspections. So I created this slide because I feel like there's a bunch of different views on what a health inspector is and does. So if you were to ask my parents what they think I do, they pretty much just think I shut down restaurants all day, which is not true. I mostly work within our school and childcare facilities. I used to do restaurant inspections, but mostly what we're trying to do is provide education. What my friends think I do, I don't know why this always happens, but for some reason they think I am a medical professional and they love to show me the different rashes that they have. I don't know how they get so many rashes. But they're like, I'm like, yep, that's a rash. You should probably go ask your medical provider what that rash is from. So I think that's what they think I do most of the day is look at rashes. What society thinks I do is hand out tickets. So we get a lot of people calling to try and get people in trouble or see if we can issue a fine or something. And that's not what I do on a day-to-day basis. And then what I think I do is just like you all, I think I save the world one day at a time, right? But what I really do is I wash my hands quite a bit. As you probably know, when I come in and do your childcare inspections, you're like, wow, you're really good at hand washing. That's hopefully what y'all say. As well as providing education. We really want to provide and push a lot of information about how we can create a healthier environment for our staff and children attending our childcare and school facilities, and providing education and information. If there's something you guys don't know, I really want to help try and find out what exactly we can do in order to create that healthier, happier environment for your children that you serve as well as your staff. So that's really what I do on a day-to-day basis and what my staff do. The purpose of health inspections. So really we're there to make observations of items or practices that might be hazardous to physical and environmental health. This might be through disease prevention and mitigation. So looking at illness policies and procedures that are in place, hand washing, cleaning, sanitizing, and disinfecting that's going on within your facility, diaper changing, infant feeding, food handling, and hygienic practices, pretty much where bacteria might be getting in and causing individuals to get sick. We also look at environmental hazards, so chemical storage, chemical handling, radon, which is a colorless, odorless gas. That is produced from the environment. And lucky for us, we have high levels of radon gas within Colorado just because of our soil composition. Lead is also one of those things. If you're in a pre-1978 building, we are somewhat concerned about asbestos, mold, pest entry, or how we're dealing with pests, and then sewage and water contamination. So that's really the main focuses of our health inspections. But that's not all. If you're curious about our health inspections, you can always go onto our website. All of our inspections are public information, so they are posted on our website. And the link is within the slide, and I'll have Amanda send the slide deck out so you guys have access to that. So if you're curious about, and I like to say, take it with a grain of salt, but a restaurant or a pool or another childcare facility inspections, once again, they're all posted online and available for the public. And really, when we do our health inspections, we cover a lot more than what was presented on that last slide. Our inspection report, so a copy of the inspection report kind of looks like this. There's check marks on there, some red, some black. What the black ones are our non-critical violations. So this is more of our wear, tear, cleaning, maintenance. I like to say, as you have time and money to do so, maybe address some of those items. And we know that's kind of some of the things. Time and money are always a struggle within our childcare and school facilities. But things that might overall or over time create an environment that might not be the most health conscious environment. The items in red are going to be what we call critical violations. So these are major violations that can have immediate effect of affecting someone's personal health. So this might be getting sick a little bit more quicker, or promoting an environment that could possibly get others sick immediately or within the near future. So those ones we really want to focus on correcting as soon as possible. We usually give about a 10-day correction time period for that. With sometimes they might be immediate corrections. So now I'll kind of dive in a little bit more about what we're looking for when we do our health inspections in each one of those columns. So one of the first things we'll do when we walk in, we'll introduce ourselves, explain who we are, why we're there. And then we'll ask to see your illness policies, and illness log. So really what we want to see on an illness policy is if someone is sick, they need to stay home. That is the best way to prevent illness from spreading, right? Is if you're not feeling very good, you should stay home. And what we really want to see is clear guidelines on how long somebody needs to stay home. So if they're having a fever or sore throat with a fever, staying home for 24 hours as per our how sick is too sick guidance issued by the state health department. So that's some of the resources you can use in order to develop some of your illness policies and procedures. Those are basic guidelines. As a childcare facility, you are always more than welcome to go above and beyond what the basic guidelines is. I have some facilities, for instance, pink eye is something that we don't require exclusion for. And I have some schools and childcare facilities that say, I want to exclude for pink eye. And that's something within your right as a business that you can do. Sometimes I say, give us a heads up, just in case a parent does call the health department to get the basic guidelines, because that's exactly what we're going to give them, is the basic guidelines for everyone. So sometimes it's helpful to know what exactly is going on in your facility, so we can help say, okay, well, here's the basic, but this facility has a really good, robust illness policy, and this is what they're saying. So this is their requirements for that. So just looping us in is always a great tool to have. The other tool that we really like are illness logs. So that's one of the things that we'll ask for when we come out to do a health inspection, if you're required to have a health inspection. An illness log is a list pretty much of children that are experiencing signs and symptoms of illness. What we use an illness log for is to determine what your baseline of illness is. So how many kids you normally have sick at your facility, maybe each week. What we use a baseline of illness for is to determine if you're experiencing an outbreak and when your outbreak is over. So everyone asks me all the time about what is an outbreak? What is the definition of an outbreak? And I would love to say it's a really simple definition, but I know we have 3 types of definitions for outbreaks. The first one being anything, and really this is the true outbreak definition, is anything that's above your baseline of illness. So if you normally have 3 kids out sick each week, and all of a sudden you have 10 kids out sick each week, you're probably having an outbreak. And that's when you should call the health department. So call me or our staff, and we're happy to, what our job is to provide you guys with tools in order to get you and your children and staff out of illness as quickly as possible. What we want to prevent is that outbreak or that illness from spreading and getting other people in your facility and the community from getting sick or ending up in the hospital or worse. And so that's what we're here to, is to really just prevent the spread of illness. We know kids get sick. We know that's part of life. And that's why we look at those increases of illness and why that's so important to give us a heads up when you're first starting and to see that illness spreading versus at the end when you have a third of your kids out sick and it's harder to dig yourself back out of that hole. So really, we're here to provide some guidelines as well as provide you with tools such as letters to parents, information on guidelines, signage, anything that would be helpful for you guys in order to not invent the wheel and get clear, consistent guidance throughout. And sometimes too, if you have parent questions that are wondering why they can't bring their kid in while they're sick, feel free to have them contact us, and we're happy to explain that to them as well. The second definition that we'll use when we look at those illness logs is really, we say 2 or more cases that are not related within a classroom. And why we have that definition is because a lot of our reportable illnesses, 2 or more is kind of the limit for that. So it's just kind of to cover that. And that's our third definition, is there are illnesses within that we see, like E. coli, that it's a reportable illness. So sometimes if you have 1 or 2 cases, it would be reportable to your local public health department to prevent that illness from spreading. That's within children or staff. So if you have a staff member or a child that has a reportable illness that's on the reportable illness list, please give us a call to let us know, and we'll make sure to provide guidance on how to handle and when that staff member or child can return back to care. The other thing we'll look for is working thermometer. So we want to make sure that if a kid does start having a fever while they're out here, that you guys have the ability to check those in order to send them home. And then if we want to make sure that there's an area that they can go to if they are required to be sent home, that's kind of separated so we don't expose others to somebody that's not feeling very well. This can be within the same classroom. We just require that there's 3 feet of separation from other children within the classroom, that they have a cot that's smooth, easily cleanable, or bed with a sheet and a blanket so they can be comfortable while they're waiting for parents to pick them up. And I stress smooth and easily cleanable because if that kid decides to vomit, we want to also try and make that as easy on our facilities as possible. And so easy cleanup is always a good thing to have. A designated restroom close by, and then it must allow for supervision. So once again, this can be in the classroom or within a director's office or another specific sick child area. The other question we'll usually ask is what would you do if somebody vomits within your classroom? That's everyone's favorite question, right? So what we want to see is that the area gets blocked off, you gather your supplies. Your supplies are going to be your protective equipment, so gloves, a mask covering, because we don't want staff breathing in those particles, absorbent material to clean up that vomit, and a disinfectant solution. Make sure you put on the gloves, mask, spray the contaminated site with a disinfectant solution, and we'll go over disinfectant a little bit later. Sprinkle that absorbent material on there, or use paper towels to soak up the liquid. Scoop and throw those items away, disinfect the site again, and then toss everything into the trash bag and discard that trash bag out in the outside trash. Staff will then want to wash their hands really well before going back to caring for others or after cleaning up their vomit. All right, and then when to wash hands. So making sure that we're washing hands before and after handling any food items, before and after eating, or after feeding a child, giving medication, applying ointment or first aid, or using a sensory table. I love this picture down here. That's a child's hand print that was from coming in from outside. So they were coming into a childcare facility and they plated that one. So that's kind of the bacterial growth that they observed on that child's hands. We'll always want to wash after diapering or toileting or handling high hazard bodily fluids like blood, puke, vomit. poop, after handling animals coming in from outside, handling chemicals, handling trash, and whatever soiled. So whenever they've got their finger up their nose or up their friend's nose, we're going to make sure they wash their hands as well. I put this one in there. Hopefully, our facilities are also really up to date on how to wash hands. I know kids sometimes are not the best, but we want to make sure that they get their hands wet, get soap, scrub for at least 20 seconds, and then rinse their hands to get all of that soap and all of those germs off, and then dry. Paper towels are what we see most often. You can use single-use clean cloth towels that are laundered after use, or a mechanical hand dryer is okay too. So we'll get that question a couple times. With hand sinks, we'll check for hot and cold running water. Within childcare facilities, we do require that the hand sink temperatures be between 90 and 120. And that's so when a kid goes to turn on that tap, they're not getting extremely hot water that's coming out. Usually building code sets hot water temperatures to 140 degrees, which is extremely hot and can cause burns on those kiddos' hands. So that's why we have them adjusted down in between 90 and 120. Hand sinks should be provided with soap, drying devices, so paper towels, single-use cloth, or those electric hand dryers, and be smooth and easily cleanable and accessible to the kids within the classroom. So if they're not tall enough to reach that hand sink, then a stool also needs to be provided. There are different alternatives to washing hands. So we get this question quite a bit, especially within our infant classrooms, just because I know trying to handle some infants that don't have a lot of neck strength, we get questions about how to make it a little bit easier to wash their hands. You can do the towel method, which you would use a clean towels to apply soap, water, and rinse those hands off after that. Or you can do the spray, and I'm sorry, I just realized I have a spelling mistake, so I apologize for that. But the spray bottle method, which is using a soapy water spray bottle and a rinse water spray bottle to apply the soap and water and rinse their hands that way, and then using a dry towel to dry their hands. We get questions quite a bit, and we'll see hand sanitizer quite a bit within some of our childcares, especially after the COVID-19 pandemic. And really with hand sanitizer, it kind of just spreads some of those virus particles around. It's really good about killing bacteria, but with virus, it's not very effective. And so we'll just kind of see that just gets kind of smushed around the hands, and it's actually the water portion of hand washing that gets all of those virus and bacterial particles off your hands. Hand sanitizer is great when you are on a field trip and you don't have access to hand sinks, and that's kind of where we like to see hand sanitizer being used, is when there's not really any good access to hand washing sinks, but we would prefer hand washing sinks be used if there is one. If you are using hand sanitizer, make sure that it is only used on children that are the age 3 and up. Really, it's a high alcohol content, and so we worry about kids getting that alcohol absorbed into their skin and then into their bodies at those younger ages. So cleaning and sanitizing. So what does it mean to clean? Cleaning is really your wash and rinse step. So your soapy water and your water, that really gets rid of any gross filth that might be on those surfaces in order for that sanitizer solution to do its job. So what is a sanitizer? Sanitizers usually require a 3-step process: that wash, rinse, and then sanitize. What we look for with our sanitizers, so your toys and tabletop sanitizer, is it's got to have instructions for use on food contact surfaces. So we're seeing this quite a bit with a lot of our bleach solutions. Make sure that you look at, when you're buying bleach, and if you use bleach for your sanitizer, make sure it's got instructions for sanitizing food contact surfaces. So it might just be stating for sanitizing dishes, cutting boards, baby bottles, things like on a Clorox label that's indicated here. But it'll have things like dishes on there and indicating that that's an approved sanitizer solution. It can't have a water rinse after applying the sanitizer. And really it's just because it leaves, it does a little bit of sanitizing after that process is finished. Doesn't mean that you can't rinse it off afterwards. We just want to make sure that it's not leaving a residual on there, and that's where that rinse would be required. You have to have your sanitizers labeled. They're all clear liquids, so it's nice to see what's actually in that spray bottle for new individuals coming in or for yourself. And then make sure if you are using bleach that it's unscented and it's regular bleach. So not the low or no splash bleach. The reason we don't want those ones used as a sanitizer solution is because there's extra additives that they add in to make it scented or no splash, low splash, that are not approved for use on food contact surfaces. So they, if a child is mouthing those surfaces, they're ingesting those chemicals that they really shouldn't be. If you are mixing your sanitizer solution at the facility, test strips are needed. So there are a couple different types of sanitizers we see. Usually it's either a chlorine sanitizer, so a bleach sanitizer, which you would use the purple strips that are pictured below, or we'll see something that's called quaternary ammonia as a sanitizer solution. And those are going to be those orange, green strips that are down in the corner as well. Make sure you're using your chemicals always per the manufacturer instructions. So if we come in for an inspection and we'll ask this question, how do you mix your sanitizer? I will give you the cheat sheet right now, and it is per the manufacturer's instructions. So when and how often do you need to sanitize things? So for hard toys, if it's in an infant and toddler room, it's going to be daily or whenever mouth. Usually that's probably daily. Everything is mouth in an infant and toddler room, right? We love to see those yuck buckets. Those are always great to see when we do our inspections. And then in any other room, so in your pre-K rooms, or it might be older toddlers. So if they're above the age of 3, really sanitizing weekly or whenever mouth is going to be the routine for that. For soft items in any of the classrooms, it's going to be weekly or whenever soiled. Same with any pillows, sheets, blankets, making sure that those are laundered weekly. Sleeping mats and cots, we'll want to make sure that those are sanitized in between users and whenever needed. So if you don't have one that is labeled with that specific child, it's going to be sanitized after use. With sensory tables, if it's water is a really good medium for bacteria to grow. Really, bacteria look for food and water in order to kind of grow and be very vibrant. And so we see a lot of illnesses spread through water, and we require that water be discarded if it's used in a sensory table that has a lot of hands in it. That it's discarded in between groups and at the end of the day, so we don't get any of that bacteria that's starting to grow. For food items, usually these are lacking kind of a lot of moisture, and so they can go a little bit longer. Weekly would be any food items or organic materials. So this is going to be like dirt that you might put in a sensory table. I will put in here that we see kinetic sand or sand a lot. And with those items, that one is a silicate. It's not considered an organic material. And so that you can go until it starts to get pretty smelly. If it starts to smell or if the color is changing, make sure you discard it at that time. The other question we get for sensory tables is the Orbeez beads, or those water beads. With those right now, they're actually a plastic with water that is absorbed in them. And as long as they're cleaned weekly, then that's fine. So if the water should be dumped at the end of the day, and then let those Orbeez dry. So if they're the reusable type, then that's fine to have, and you can rehydrate those back up. If they do start to smell or get pretty dirty, then that's when we would require that they be discarded at that point in time. My guess is when they go through regulation revisions, that might change. So I just want to give everyone kind of a heads up on that one. That just wasn't considered when we went through when the regulations were created in 2016. So Orbeez weren't really at the front then. And then for bottle warming devices, so like crock pots, things like that, you're going to want to change that water out daily, and then wash, rinse, and sanitize the inside portion of that. Some other methods for sanitizing would be using your laundry machine. So your washer and dryer must reach 140 in order to sanitize appropriately. Usually within childcare facilities, our hot water is adjusted in order to reach that 90 to 120 at the hand sink. So we see the dryer used as a way to sanitize things like soft toys and things like that. Or you can add bleach to the wash cycle. Just make sure you're following the manufacturer's instructions for sanitizing soft items on that. Dish machine, we'll see that one quite a bit. Usually we'll have our little test strips to check the dish machine. So we look for 150 on the dish surface, or if you're using a commercial dish machine, we'll usually look for 160 degrees. It's a high temp, or if it's using chlorine, in between 50 and 200 parts per million. And then if you do need to steam clean, so let's say someone does puke on the carpet and you need to steam clean that up, we just want to make sure that it's heated steam cleaner, so it reaches that 212 degrees and it's sitting there for about 1 minute, or 158 degrees for 5 minutes. For disinfecting. So I like to say disinfecting is for disgusting things. So if it belongs inside your body and it came outside of your body, you're probably going to want to use a disinfectant. So this is going to be your poop, blood, vomit, really any of that gross stuff that comes outside your body. And what that does is it kills any remaining virus and bacteria that might be on those surfaces, but it is a really, really strong solution. So sometimes it can leave a residue on those surfaces, and we get worried about using a disinfectant on food contact surfaces like toys and tabletops, because those are highly mouthed surfaces. So we worry about chemical poisoning that way, that film that it leaves on those surfaces, if they are disinfected, then ends up in a child's mouth. And so once again, you'll want to follow your manufacturer's instructions on that. Doesn't mean you can't use a disinfectant on those surfaces. We just don't really want them used on a day-to-day portion. Your sanitizer is going to be way more effective on your toys and tabletops. It's going to be a little bit less work for you guys. Because a lot of disinfectants require a water rinse if using on those surfaces afterwards. For like, let's say diaper changing, those are not mouth surfaces. So you'll want to use that if you have a disinfectant on a diaper changing surfaces, you can disinfect that surface, and then you don't have to do a water rinse after that. We have some criteria that we look at to make sure a disinfectant is approved for use within our childcare facilities. It does have to kill these 3 types of bacteria that are listed on this slide. If you guys have any questions, if a disinfectant is approved for use, or if that's something that you should be using, feel free to reach out to us over here at Adams County Health Department, and we're happy to answer that questions for you and give you kind of a lowdown on those sanitizers and disinfectants. If you're using bleach, once again, we want to make sure it's not a scented bleach, or it is not a low or no splash bleach. And then if you're mixing it at the facility, test strips are going to be required, because we want to make sure that that concentration that it needs to be mixed at is correct. If it comes in pre-mixed, so a bottle ready to go, ready to spray, no test strips are required. So how often do you need to disinfect? Really, this is going to be in diapering areas, or whenever it's contaminated with high hazard bodily fluids. So any blood, vomit, poop, pee. You'll want to do diaper changing tables after use. Wading pools. Wading pools will be something that you'll want to disinfect instead of sanitizing. And the reason being is anytime you get into a pool, it washes off all of the poop particles that are on your bottom and ends up in that pool. The more you know, right? So that's why we require a disinfectant in those wading pools after use. And then removable toilet seat inserts. So these are going to be those ones that you can literally take off the toilet. We'll want to make sure that those are disinfected in between users as well, just because storage on that one can get a little dicey. Sometimes we want to make sure we're not contaminating the wall where it's hanging out, or the floor. Well, it shouldn't be sitting on the floor, but those areas where it might be stored. And usually kids kind of sometimes have access to those. So diapering, everyone's favorite, right? We make it so easy. It's a 13-step process. So we want to make sure that we're gathering all the necessary supplies, putting on clean gloves, if getting that ointment available. I know on these slides, so just kind of to give you a heads up, the items that are in black are required by the health department. And per our regulations, the items that are in orange are going to be part of the Colorado Shines requirements. And so it's not really a requirement per our regulations. So like putting the small amount of ointment onto that clean paper towel is not a requirement through health, but it is a requirement through Shines. And so that's kind of, I know sometimes that can be a little bit confusing to individuals or inspectors trying to explain the process as well, just so you guys are aware. So putting on clean gloves, making sure that that child's on a clean changing mat, removing the soiled diaper from the child. If you can, try and put the dirty gloves or encircle the diaper with the gloves that you are using, throw those away. It's not a requirement to try and put those in there. If you can put it in like a plastic bag or something like that into the dumpster, that's fine too. Usually we'll say try and get those gloves over that diaper, just so you're not continuing to use that same pair of gloves in order to put the clean diaper back on the child. But remove the soiled diaper, clean the child, place those in a trash can. Trash cans do need to be provided with a plastic liner as well as a lid, so that way kids aren't getting into the trash can that has all of the poopy diapers in there. Put the clean diaper back on the child, wash the child's hands, and then go back, disinfect the area, and then wash your hands off afterwards. The reason why we want staff to wash theirs at the end is because if you're applying that disinfectant solution, if any were to drip onto there, you're not having to wash your hands really twice during that time period. Infant feeding, so making sure to wash hands before preparing foods for anybody else. This includes infant feeding. We usually have a designated sink that is not the diaper changing sink, so make sure you're not mixing bottles in the same sink that you are using to wash your hands after diaper changing. Never heat those bottles in the microwave. labeling with infant bottles, so making sure that the bottles and bags are labeled with the child's first and last name, the date they received them, and then if it is breast milk, some identifying way to determine that it is breast milk. We've been seeing an increase of our accidental breast milk feedings, and so having those color-coded stickers or labels on there has definitely helped. This might be color-coded stickers, a rubber band around them, anything that you can think of that would be that would designate it as being breast milk versus a formula-based solution. We'll want to make sure that any breast milk or formula is stored below 41 degrees, or if you're mixing formula, it's mixed per the manufacturer's instructions. We get a lot of confusion on this one as well too, so make sure that once you start feeding that infant, that bottle is discarded after that hour feeding period. And then if you do have any unused breast milk or formula that is prepared for that day, that it's returned to the parents at the end of the day, or discarded. Frozen breast milk you can keep though for longer than that. Some food safety, hygienic practices, information. So make sure you're washing hands before preparing food for others. This includes entering the kitchen, after using the restrooms. Make sure you're rinsing, and sanitizing any food preparations areas and dishes. Make sure you're not handling any food items that are ready to eat. This is food that is not going through a cook step, so you can put directly in your mouth. With your bare hands, we just don't want anything that's on your hands getting onto that food item that's going right into somebody's mouth. So you can use gloves, tongs, deli tissues, things like that. Making sure not to thaw food at room temperature, just like Mama used to do it, right? You put the chicken or the turkey on the countertop, and 6 hours later, you've got a nice warm turkey on the outside and frozen turkey on the inside. Meanwhile, that bacteria is kind of just growing on that surface. And so you can do thawing using a refrigerator or cold running water. That way it keeps that chicken or turkey nice and cold on the outside, preventing bacterial growth. And then if staff are preparing food for others, we just want to make sure that they're not doing diapering activities while preparing foods for others outside of their group. So if you have a kitchen staff worker that subs into, let's say, an infant room in the mornings and then goes into the kitchen, that would not be okay with us. And the main reason being is that if they do end up getting something on their hands, so some fecal material, and then go and start preparing food for we worry about an outbreak spreading that way. Doesn't mean that they can't do kitchen activities in the morning. And then if in the afternoon they need to sub in an infant classroom at the end of the day, once they're done preparing foods for the entire facility, then that would be okay. We just want to make sure that they're not doing one and then the other, and kind of spreading the love out to other classrooms. Food safety temperatures. So any refrigerated, anything that you need to keep cold, we want to make sure it's at 41 degrees or below. Anything hot at 135 and above. If you're doing any cooking, so any raw vegetables is going to be 135. Fish or pork, 145. Mainly what we see within our childcare facilities, like raw hamburger, meat, maybe some eggs, and that's going to be your 155 cook temperature. And chicken is our highest at 165. If you're doing any cooling, what we want to see is that it's done within a total of 6 hours. There are specific criteria for our childcare facilities in order to cool things. They must have commercial equipment. Once again, this is if you're required to be inspected by the health department by licensing. And if you do have that equipment available, you can cool. What we want to see is that it's cooled from 135 down to 70 within the first 2 hours. Usually this is done with ice wands or ice baths, putting it into a freezer right away, and stirring that occasionally to make sure all parts of that food item is cooled down as quickly as possible. And then the next 4 hours that's broken out of that, it should go from 70 down to 41 degrees. Once again, we talked a little bit about thawing, but making sure foods that are thawing are kept at 41 degrees or below too. So this might be thawing underneath cold running water or placing in a refrigerator. Within your refrigerator, we look at how things are stored. So we want to make sure we're not contaminating things if they do leak onto each other. So we like we kind of situate them by cooking temperature. So any raw chicken, raw turkey is going to be at the bottom, and any ready to eat foods are going to be at the top. And that is because if, let's say, we have a raw egg that is cracked and starts leaking onto raw hamburger, it's going to get cooked off in that cooking process. So any bacteria that we would worry about that might be in contamination with raw eggs will get cooked off at that 155 raw hamburger cook temp. Date marking. So pretty much if you have, I'm going to just kind of briefly touch on this one. If you have refrigerated items that are not used within 24 hours, make sure to label them or date mark them, and then to be discarded within 7 days is going to be the easiest way to explain this. There are some foods that are exempt from date marking. The reason date marking exists is to prevent growth of a certain bacteria called Listeria, which grows really well within cold environments. And we worry about with highly susceptible populations like children. And so that's the best way I can explain that in the easiest manner. If you have questions about date marking, please feel free to reach out to us. Date marking, you can either label it with the day that it was open or the day it needs to be discarded, however you want to do that within your facility. Classroom hygienic practices, so making sure things are labeled like water bottles or toothbrushes, keeping personal items separated. If you have staff personal items, make sure that they're kept out of the reach of kids. I did hear of a story, I think this was in Texas, where a staff member had some gummies that were not gummy bears in their purse, and a child did get access to those gummies, which is a reason why we want to make sure that those are kept out of the reach of kids. Infant staff, we want to make sure that they're wearing smocks or non-irritating clothes, just in case somebody does decide to spit up on their clothes. We have extra available for them to change out of, and they're not ruining their street clothes. If you're storing things in a restroom, so I know storage is always a hard one within our childcare facilities, make sure it's in a secondary container. So either a closed cabinet or like a Rubbermaid container that has a lid. And the reason for that is when you do flush the toilet, those poop particles kind of go everywhere. And so we want to try and prevent from those poop particles from getting on any toys or clean linens that might be stored within those restrooms. For ventilation, no air fresheners. I'm sorry, we don't really allow those. And that's just because they can be triggers for asthma for some kids and adults. And then we want to make sure that if you have any food items that are used for art and science, make sure to label them not for consumption or do not eat, something that tells somebody that that is not food. The reason for that is we did have a facility that they had a sensory table full of dried beans and some extra ones in the cabinet, and they did have a kitchen on site, and they used those beans afterwards, cooked them up, and then served it for lunch that day, and with all the kids touching those sensory beans. And so one person ruins it for everybody, and now we want those labeled do not eat for those. chemicals, making sure that you're labeling all chemicals, they're kept out of reach of kids. And this one might seem obvious, but we see this quite a bit as well, making sure not to put chemicals in containers that previously had food in it. So like Windex in a Gatorade bottle, they're both blue solutions. That could be very confusing to some. Sometimes we see the label of the Gatorade bottle still on there. And so we just don't want anybody drinking what is now Windex, thinking it's Gatorade. So radon, we do ask for radon test results. And what we're looking for with radon tests is that we have a radon test result for each frequently occupied room. And if it's on a second level, that 10% of those rooms that are not in touch with the soil are tested. We recommend retesting for radon every 5 years. However, if you have one set of radon test results for each frequently occupied room that meet the regulation requirements, then that's fine. That is the requirement, and the requirement has been made. So it's only a recommendation to retest every 5 years. We do require radon tests to be done at least within 6 months from the start of operation, and there is no requirement to put in a mitigation system. So even if you do have, I'm going to say a high level, which is over 4 picocuries per liter of radon, you're not required to put in a radon mitigation system at this time. Lead and asbestos. So lead we're really concerned about in our pre-1978 buildings. That's when lead was used a lot within paint to make the colors more vibrant. We are very concerned lead just as is not really the concern. Lead paint as is isn't the concern. It's when it starts chipping and peeling that we worry about those kids picking up or peeling those pieces off of the walls and then putting it in their mouth. Lead is really sweet, and so we'll start seeing teeth marks on some of those windowsills that might have been painted with lead. Lead is also in some old plumbing, and so there's a lead copper rule. I'm sure most of you have already done some testing with the state health department on water and lead. With asbestos, we get concerned about damaged materials that contain asbestos. So this is mostly a concern within renovations. There are still some building materials that have asbestos in it coming out today. And so if you're doing any remodeling, one of the things that we look at is making sure that there's asbestos test results for those that are going through extensive remodeling. For pests, we look at kind of those landscaping, so making sure that there's not a lot of tall weeds, trim bushes around the building. They really like just places to hide. Making sure that there's sealed holes around the building. And then mold is really just anywhere that might have water collection can create mold. With drinking water, we want to make sure it's accessible to kids and it's from an approved source. Pools, we want to make sure that they're used by toilet trained kids and not during an outbreak. And then if you are on a septic tank, that those are pumped every 4 years. And so when to call us, if you're having an outbreak, or if you have a reportable illness, animal bites, if a kid gets bitten by a dog, or any contact with wildlife. Sometimes we'll get calls for bats that they'll find on the ground on the playground. So make sure to give us a call for that. If there's any accidental breast milk feedings, needle sticks, if you're experiencing an imminent health hazard, so this might be a loss of refrigeration, sewage backup, lack of water, or if you can't maintain building temperature at 68 degrees or above, that might be a time when you would want to call us so we can get a plan in place for either how you plan on operating from there, or if we need to consider sending kids home for the day until that gets fixed. Usually we try our best not to try and send everybody home. We want to make sure that you guys are able to operate your business as well. Give us a call if you're doing any expanding or remodeling, or whenever prompted by licensing, or whenever you have a question. We're here to help. My information is down at the bottom of the slide. Once again, I'll send these out, I'll have Amanda send them out, and feel free to call or email anytime. We're here to help. I know after COVID-19, it probably doesn't feel that way. And thank you guys for listening to me for an hour. I appreciate it. And I hope you have a good rest of your day.
Thank you, Candace. Did anybody have any questions? I know
Thank
we have like
you.
1 minute, but you're more welcome to ask a question. And then there's just a few people that didn't send me their first, last name, and email address. I can't send you anything unless I have that from you. If you could pretty please just put that in the chat real quick. Don't want you to miss out on your certificate and all the backup. And then, yeah, we appreciate all of you on this call, and we appreciate you, Candace, for taking time out of your day and going over some great stuff. There was a lot of info I didn't even know, so good to know. All righty. Well, everybody have a great rest of your afternoon then.